Okay, so good afternoon, everyone. I hope you had a wonderful day. We're going to be talking a little bit about tackling inequality in workplace healthcare. I'm Camilla Brooke, Head of Corporate SME and Intermediary at Simplyhealth. I've been there nearly 20 years in both Healthplan and Simplyhealth, and in the last 10 years I've been working with clients, helping them introduce health and dental plans as part of their health and wellbeing strategy.
Yeah, hello, and I'm Tina Kennedy. I'm the Product Director at Simplyhealth. Nice to meet you all.
So before we kick off, we're actually going to be asking you for some feedback. We were going to have a beautiful Wordle, which we don't have. So we're going back to basics, and I'm going to be asking you to shout out what currently are the biggest challenges that you are facing and your employees when it comes to healthcare in the future. So if we just get some ideas from the room, please. Cost?
Access to services.
Access, okay. Anything else? Variety in terms of too much variety, too little, or the ability to navigate this. A lot of similar themes coming out, especially with the autumn budget. I know cost is a big challenge for everyone at the moment, and ensuring that we're really maximising the most from those benefits. So we're going to be talking through a few stats today. A lot of these have come through research we've done in partnership with the CIPD, but also research we've done with some of our partners. So if you would like the sources and references for that, please pop over to the Simplyhealth stand, speak to Claire and Andy, we'll take your details and we can share with you the full breadth of resources that we have at our disposal. So we all know there's a big challenge at the moment. There's record NHS waiting times, and we've currently got 7.6 million people on NHS waiting lists. The impact of this is leading to reduced productivity, but also cost for employers. And the really sad reality of this is 1/3 of employees would have taken fewer sick days if they were able to access some of these services, such as VGPs. But these are just stats. Until those access challenges really impact you or one of your employees. So instead of going into some of these stats, I want to share a personal story with you. A few weeks ago, I was working at my mum's home. She had popped out for lunch and I was speaking to her partner, and he had told me, your mum's had a bit of a health scare, which she didn't really want to share with you. She's been having a lot of problems with her hearing. We all know this. You can hear Coronation Street at the end of the road. It's so loud. And she didn't want to do anything about it. She's been in the NHS for 45 years as a nurse, and they're the worst people at going out and looking after themselves and getting checked out. So she had had a few tests, she'd been referred to the hospital, and they'd found something they didn't like. They said, look, you're going to need to go and see an ENT consultant, and we'd like you to go and have an MRI scan. And I was like, well, this is the first I've heard of this. I'm really scared. Like, what does this mean for her? And he said, well, the ENT specialist is in 3 weeks, and they said the current waiting time to go for an MRI scan is 10 weeks after that. And I was like, well, that's too long. That's going to take us past Christmas. We need to know what's going on. I'm lucky because I work for a healthcare provider, and as part of my health cash plan, I have access to imaging services. So that afternoon, I was able to ring that scan company and got an MRI booked for her within 10 working days. We had that on Saturday. I got a call at 7 o'clock last night when I was bathing my 4-year-old. She's got the all clear. She's fine. I rang her up. I was like, Mum, it's fine. You're okay. The relief for her, for me. I was texting people for the next 10 minutes that knew what was going on, and everyone was so relieved. But it brought home to me the panic of not knowing where to go. And this was someone that had worked in the NHS for 45 years. And this is a reality for many UK employees. 1.4 million employees currently have a health cash plan. 5.6 million currently have private medical insurance. That leaves 26 million employees in the UK without healthcare cover. Now, I'm really fortunate, and I see that as luck more than anything, that I have the ability to access these additional services. Otherwise, we'd be still in the middle of that waiting period of 13 weeks to point of diagnosis, let alone if she had needed treatment. And the impact of this doesn't just impact the individual, it impacts the family, the friends, the carers, the people that are invested in that person's well-being. So whether it is the employee funding it, or the employer funding it, whether it's a full health plan of sorts or just signposting information of additional services that are out there, giving employees knowledge, options on how they can better access services and navigate a really complex system is really crucial. Because I think now, what if it is one of our employees going through that and they're being told they've got 13 weeks to find out if there's something wrong with them, and having to navigate a really complex healthcare system whilst maintaining high levels of productivity is a real challenge.
Thanks, Camilla. So Camilla's talked about a personal story of not being able to get access to healthcare. We talked at the beginning about some of the challenges of access, and cost is a big one, and obviously the budget this time round hasn't helped in that situation. But the vast majority of people don't have access other than via the NHS, and we do know the NHS is in trouble. No one wants to say anything negative about the NHS, but we do have a provision of service problem, and that does impact people. And what we've seen through our research is that healthcare is actually the second top priority when someone's looking for a job. So they're seeing the impact. It's really important to people seeking work, and an employer that offers healthcare provision will have a better ability to attract talent. And then 64% of people who are working for an employer with healthcare, that's the reason that they're staying in their job, in their role with that company. So there's no doubt that actually providing healthcare provision really, really does support that kind of attraction and retention of top talent. So alongside that, we talked about productivity and how actually, you were impacted in productivity at work by your mum's situation. Many people are, and it's less about necessarily having health cover, but trying to find how to get help that is really impactful. So, time spent researching, Dr. Google, all the rest of it, how am I going to get help, actually really impacts people's productivity. And so providing access or signposting or navigation to find that help is actually really valuable. And actually, thirdly, having healthcare does really bring financial rewards. So a lot of our research has looked at the impact, the value driven, the return on that investment. And we can actually, trace sort of for every £1 spent on mental health issues or support for your workforce, you get £4.70 back in additional productivity. So that's a 1 to 5 or a 5 to 1 return, and that's really, really positive. So we shouldn't see these just as a cost, we should see them as providing value and return on that investment. When we talk about the main causes of absenteeism, a lot of it's driven at the moment through both mental health issues and needing mental health support, but also through aches and pains, so musculoskeletal. They're the top 2 causes of workplace absenteeism at the moment. I don't know if that's what you're seeing in your business, but they're certainly the top 2 that are coming through strongly in our research. In fact, 51% of people on long-term sick are due to mental health issues. So it's a really big issue that we need to tackle. And I think some of the challenges in healthcare provision, even those people that we showed on that chart that are insured, is how do I use those services? So it's not even about being insured or uninsured in many cases. It's actually, I am insured, I don't really know how to access those services. So one of the big challenges is how we make that easier. And how do you make that equitable so that you can actually provide access to everybody and not just those, the most senior people in your organisation or certain pockets of the organisation? So we see some real challenges, and some of which you've talked about earlier, but the ones that we are hearing from our customers are, I've got multiple providers of a virtual GP. I've got many virtual GPs. I don't really know how to facilitate my employees finding a virtual GP, even though I've got 4 of them. So that is one of the challenges. A lot of people are feeling really strongly about more equitable provision. So how do I provide provision across a much wider part of my workforce? How do I focus on prevention and primary care? Because we know that if you can focus on those two areas, we can drive better outcomes more quickly and put less pressure on secondary care and that medical cost, the inflationary cost of medicine at the moment. So all the PMI inflation costs, that's all secondary care. They're brilliant when you're really in trouble, but how do we prevent it getting to that point? How do we enable people to get well sooner? So we ask ourselves at Simplyhealth, and for the purposes of today, for the kind of look at how healthcare provision is changing, what if we could? What if we could make access easy, simple, straightforward, and really promote usage of services so that people can get well sooner? What if we can focus on that prevention and primary care so that we can help people not put that pressure on the secondary care system and really find benefits that are personalised and individual and add real value to individual people rather than a blanket scheme that kind of doesn't quite fit the mark? How do we, and those challenges we're trying to address through other things as well. So how do we get people to use and connect with healthcare, and how do we connect healthcare together? We all know that journey from kind of going to a GP, maybe getting a scan, as your mum did, getting those results back to the GP, kind of going through that journey is really difficult. So could we connect that healthcare ecosystem to make it really easy to use, to navigate, and to share data between providers so that actually your record goes with you, and suddenly that kind of resolves a lot of the private healthcare challenges. And also we looked at how we could vary the way that someone might pay. I'm happy to self-pay for some services. Children's neurodiversity, for example, could be something that I would very happily pay for if I could get an appointment in the next 3 years. We might co-pay if you know one of your employees is really struggling with a mental health issue that they can't get help for. You could help pay for that service. Or you could actually fully fund that service if it's really critical for their ongoing productivity. I think through looking at that in that way and thinking about those challenges, we can really think about how we can drive real value for employees in finding and accessing services that can help them to solve their healthcare needs. I think that for a business, for your business, you can then really prove value. One of the big challenges of any kind of healthcare provision from year to year is, first of all, convincing that this is going to deliver value and return on investment, but then continuing to convince your employer that that's going to be the case. And what you need to do that is lots and lots of data and insight. And obviously through that work and through that kind of helping people to get back to work, we can really boost the economy as well. So it's kind of a triple way win. So I want to leave you with sort of 3 key takeaways around health and healthcare provision and how you can help your organisation and your employees. I think the first step is obviously having a very clear benefit strategy. So what is it we're trying to achieve? You know, thinking about the whole of workforce, how can we mix services that deliver benefit to everybody? And it doesn't have to be one size fits all. It can be free access to services. It can be self-pay, co-pay, fully funded. It doesn't have to be insurance. You know, one of the reasons that we've got such medical inflation is because of insurance costs, right? So let's look outside of that and look at how we can provide a mix of benefits to a mix of people, because not one size fits all. How can you focus in that strategy around prevention and primary care? And how can you really personalise it to drive that value for that employee, but also the engagement that you need with that employee to use the services? Those are all really important factors in your benefit strategy. When you move from your benefit strategy, the next thing is to look for a provider. And obviously we're a provider, but I would encourage you to think about how that provider is using technology to provide a really easy access point for your employees. The thing that's different, I think, that's changing in this market is that user experience. So helping people to not just use services, but to navigate their healthcare and how to do that between providers and between the NHS and private medical. So really that sort of provider that you're looking for really needs to have that brilliant technology, that focus on the user experience. You need to work really carefully and closely with that provider around data and insight that you're getting around your usage. So actually what you want to know is who's using the service and who isn't, so that you can encourage more usage. You don't need the personal data about what they're doing, but actually the usage rate really helps you to understand if people are getting value from that particular service, how you could engage them further through campaigns and other activities. Providers are always really happy to work with you to grow that user base and to grow that value within the use of the product as well. So looking at proactive engagement campaigns within the business to really drive usage and working with your provider to help with that. And then finally, don't create a benefit strategy and kind of leave it on the shelf until next year. It's an obvious one, right? But one of the real benefits of having a digital capability is you get a lot of data and a lot of insight, which enables you, if you choose a provider with that digital front end, enables you to get the data around what's working and probably more importantly, what isn't. And also how to tailor. We talked about personalisation being really critical. It's really important to tailor your benefits package to individuals. And actually in a digital world, that's easier than it's ever been before. So, continually work with the provider, look at that data and insight, get them to help you to understand the benefits that are best fit for your employees, and then provide more of those. And also that data can help you go back to your board every year and get continued funding, because you can prove value, you can prove return on investment, you can prove how quickly you can get people back into work and successfully into work, happy into work, which is obviously very important too. So if you think about those three things, create a strategy that's inclusive, that involves your whole of workforce and really delivers value to them. Find a way that delivers that through a really easy to use interface that really does proactively drive engagement and make sure people are using benefits. Because quite often we provide benefits to companies and it's not used, and actually that's not what we're here for, right? We want proactive usage, we want people to benefit, we want people to use it to get back to work. And we keep that strategy refreshed and keep those benefits refreshed, and work with your provider to engage with the people in your organisation to use it too.